This is the rehabilitation case study on an ACL tear by Callie Scory and Cassandra Hedinger. This is our patient, Tara. She is a 30-year-old high school health teacher as well as the girls' high school varsity soccer coach. When she's not working, she loves working out. She runs about 10 miles a week and plays on a recreational soccer league team 2 times a week. She also enjoys playing with her 2-year-old son as well as assisting with Sunday school at her church on Sundays. During our initial evaluation of the patient, we determined that she came into the clinic 1 week after having ACL reconstruction surgery. She related that during varsity practice, she was participating in a team scrimmage, and while turning to cut the ball, her knee buckled underneath her, at which point she heard a popping sound. Her assistant coach drove her to the ER, where she was diagnosed with an isolated grade ACL3 ACL tear. Her chief complaint was right knee pain, with sharp pain primarily at the incisions as well as some constant achy general knee pain. She doesn't have any pertinent past medical or family history, and she's currently on her last few pills of hydrocodone, but alternating 600 milligrams ibuprofen and 600 milligrams Tylenol. The ACL is a ligament in the knee called the anterior cruciate ligament. It runs from our posterior medial corner of our lateral femoral epicondyle to our anterior medial intercondyloid eminence of our tibia. The ACL is essential for normal knee function as well as stability. The primary functions are preventing the tibia from sliding too far forward on the femur as well as hyperextension of the knee. Since our patient had a patellar tendon autograft done to surgically reconstruct her ACL, there are many factors that we will need to consider in her rehab plans. Firstly, since she did have surgical intervention, our post-surgery concerns include excessive swelling of her lower extremity, specifically around her knee joint, but also extending distally to her ankle joint. Also, we need to be aware and watch for infection of the surgical incisions. Because she had a patellar tendon graft during the first 4 weeks of rehab, we need to avoid any resisted knee extension to protect the graft. Our long-term goal is, and here I will say our long-term goal, and hopefully this is enough time to say it in. Our first phase of rehabilitation is going to last about 4 weeks. In this first phase, we really want to firstly focus on the patient's pain as well as their swelling stemming from their invasive surgery. To avoid swelling in the ankle, as well as to get the knee moving, the patient should perform ankle pumps. For the ankle pump exercise, you're going to have your patient laying supine on the plinth. Their ankles are going to be slightly off the table. You're going to have them pull their ankle into a dorsiflex position and subsequently have them plantar flex. They're going to repeat this motion. This exercise should be performed multiple times throughout the day for about 2 minutes each. After managing the patient's pain and swelling, we want to start our patient early in regaining their lost range of motion. Knee extension is the first motion we are looking to restore. An exercise to help in regaining the knee extension capability, which also helps limit the quadriceps femoris weakness, are quad sets. For the isometric quad set, the patient is going to be in a long sit position. They're going to contract their quadriceps, creating a visible superior movement of their patella. This contraction should be held for about 5 to 8 seconds, followed by a gradual decline into full relaxation. During this phase, we also want to start increasing the patient's knee flexion, as well as have the patient engage in exercises that engage their core, as well as help maintain their cardiovascular fitness levels. For your upper extremity, for the ankle pump exercise, Our second phase of rehabilitation is going to span from weeks 4 to 8. At about 4 to 5 weeks, the patient will be discharged from their brace, provided they can fully weight bear on their lower extremity and can ambulate with no pain or antalgic gait. In this phase, we want to focus on completion of regaining all of the patient's lost range of motion, specifically in knee flexion. An example of an exercise used to regain the end range knee flexion is the standing quad stretch. For the straight leg raise, the patient will lie supine with their uninvolved knee flexed and their involved. For the straight leg raise, the patient will lie supine with their uninvolved knee flexed and their involved knee fully extended. Their hip should be in neutral. The patient will isometrically contract their quads and keep their knees straight. The patient should perform the double leg balance with a foam pad. Why are you doing that? For the standing quadricep stretch, the patient should stand with their glutes to the table. Their knee should be flexed and the dorsal part of their foot resting on the surface of the table. The patient should try to pull their foot into their buttocks. Approximately 30 seconds and repeat multiple times a day. Nearing the end of phase 2, we want our patient to demonstrate the ability to successfully balance. An exercise the patient can perform in the progression to attain balance goals would be the eyes open double leg squat with mirror feedback. For the straight leg raise, the patient will lie supine balance with a foam pad and visual feedback. The patient should stand shoulder width apart on an Airex pad. The patient can then perform a squat while looking in the mirror for visual cues for self-correction. As in every phase of the rehabilitation process, exercises that engage core and focus on cardiovascular activity are vital for return to play. For the standing quad. For the single leg bridge,
for soccer ball toe touches, for tuck jumps, the patient is going to start with their feet shoulder width.
Okay, well. Grade 3 ACL tears can be treated both operative and non-operatively. Although it is important to note that most cases of non-operative treatment require surgery in the long run. Here I'm going to say all this stuff, and it'll probably add about a minute. And here's our works cited.